The recommended steps for the REBOA catheter insertion are explained in this lecture. Measurement sites. For Zone 1, place the tip of the catheter to the sternal notch and measure the distance between the sternal notch and femoral access site. For Zone 3, place the tip of the catheter to the xiphoid process and measure the distance from the xiphoid process to the access site. Record your length using the measurement points on the catheter in centimeters. The balloon catheter length should be shorter than the insertion site suprasternal notch distance and longer than the insertion site xiphoid process distance to implement REBOA to Zone 1 safely. Empty the balloon using a syringe and close the stopcock. Then, slide the orange peel away to cover the P-tip and get ready to insert through the sheath. Flush the arterial line to remove air and prepare the catheter for invasive blood pressure monitoring. Attach the catheter to the arterial blood pressure monitor. Now you are ready to insert the REBOA catheter. The insertion steps are given below. Insert the peel away to the 7 French introducer. Advance the catheter until the 15 centimeter mark on the ER REBOA catheter. Slide the peel away back on the catheter shaft. Continue to advance the catheter to the appropriate zone at the pre-measured depth. If available, confirm the placement with radiographs. Be careful to hold the catheter in place at the pre-measured depth. Zone 1 may require as little as 8 milliliters and Zone 3 as little as 2 milliliters to achieve occlusion. So start with the 8 milliliters for Zone 1 and 2 milliliters for Zone 3. Now inflate the balloon until observing blood pressure elevation in the monitor. Acute elevation of blood pressure is a sign of adequate occlusion of the aorta. The catheter can travel inside the artery even if the balloon was inflated accordingly. This complication must be avoided with proper stabilization of the catheter. The preferred method is to suture the catheter to the skin at the insertion site with the standard technique. The provider is responsible for prevention of the catheter migration, particularly during patient transport.